Hello, everyone. I'm Willow Bay, Dean of USC Annenberg School for Communication and Journalism, and it is my pleasure to welcome you today to our session, Coping with COVID, a really important conversation about young adults and mental health. Today, we have a really extraordinary opportunity to bring together one of our nation's most visible public health leaders who has invested deeply in the health of this nation and its young people, Dr. Vivek Murthy. He's just a few weeks into his role, really, as our nation's 21st Surgeon General, a post that he happens to be familiar with, having served as our 19th Surgeon General during the Obama administration. Dr. Murthy, we are honored to have you here with us. Let me just check. I'm scrolling back and forth. And if he is not here, he's going to slide in because he does work for President Biden and apparently was called into a meeting. So he'll slide in just a minute. We also have with us Jim Steyer, who is a powerful advocate for young people and families, a Stanford professor, the founder and CEO of Common Sense Media, and Jim comes equipped with their very latest study on the mental health of young adults. And USC's own Chief Medical Officer for Student Health, to whom we are incredibly grateful for her own relentless support for the physical and mental well-being of our students, Dr. Sarah Van Orman. Also joining me in moderating this conversation today are spectacular Annenberg students, Josie Bullen, Abel, Jaquez, and Anushka, Joshi, each of whom brings their own deep commitment to the mental well-being of this generation of young people. So welcome to all of you. It's fantastic to have you here with us. Before we start our conversation, I'd like to share a preview of a new report from Common Sense, Coping with COVID, How Young People Use Digital Media to Manage Their Mental Health, which truly advances a deeper understanding of the mental health of young adults and teens, and gives us a look into the ways in which young people are navigating their own health challenges. So let's take a look at this video and then we'll come back and talk. Jim?
COVID-19 can be characterized as a pandemic.
The coronavirus is a pandemic.
Many schools around the world, as you know, have shut down.
It's going to have a huge impact.
I mean, it just starts blowing my mind that we just didn't even think about this. We just sent everyone home, assumed that they had a computer or a tablet or a printer, assumed they had internet.
Oftentimes, my video will freeze and then it will crash.
There weren't structured classes and that we basically just got handed sheets, and I wasn't able to reach my teachers like I could during school.
I've never said this before, but I miss school.
It ruined our graduation and ruined the rest of our senior year.
I definitely feel a little more frustrated and sad.
I definitely know a lot of people who are struggling with depression and anxiety.
I'd say I've retreated to a more isolated version of myself.
My name is Susanna Fox, and I'm a co-author of the report. Unfortunately, what the survey shows is that depression rates among 14 to 22-year-olds has gone up significantly since 2018.
Young people who are people of color and living in communities that are low income, where there are a lot more essential workers, they have been disproportionately impacted by COVID. So they're much more likely to be depressed than peers.
I have a friend who has some family troubles, and I feel like her stress has been amplified now that, like, with quarantine and stuff like that.
Just really not knowing how things are going to turn out and just rethinking your future and your life. And it really took a toll on me.
Social media is a place that can be used for great things and connections and positive impact, but it's also a place where it can be used for comparison and self-doubt.
We're seeing that young people report instances of body shaming, racist remarks, sexist or homophobic comments, and that these are up slightly higher than what we saw in 2018.
So even as teens go online to connect with each other and try to seek inspiration and community, they are unfortunately also finding hate.
I've now taken control over how much I use social media and what ways I am going to use social media.
One of the encouraging findings is that teens and young adults are proactive. They're going online to take depression screeners. They're going online to try and find that health app that they think could really help them.
Nearly half of the young people studied in this report said that they engaged with a health provider online.
You need to have your fingertips for the resources and tools to help you get through those tough days.
Being able to use telehealth as a way to reach populations that otherwise might have difficult access.
We have to support teens being aware of what they can and will see on social media and help them bolster their ability to cope with it when it exists.
As this young population comes out of the pandemic, we just need to stay very attuned to what their mental health needs are.
Even if it feels safer to keep to yourself, to ask for help.
It's okay to ask for resources. It's okay to go to therapy. It's okay to build your own personal toolkit to make you have a better day each and every day when it's hard.
If you see your teen or young adult spending all their time on the phone, it might actually be that they're taking care of themselves. They are reaching out. And what we need to do is meet them where they are, and they're online.
So, Jim, I mean, congratulations. This report, I think, is incredible. You've been studying, Common Sense has been studying young people in digital media use for years. So why did you make the shift to mental health in this report? And did you suspect the problem was growing more acute during COVID? And tell us also a little bit about what the data suggests.
So thank you, Willow, and welcome to everybody. It's so great to be here with everybody from the Annenberg School and such a really terrific group of folks. Willow, one of the things we have been concerned about the impact of technology on young people's mental health for several years now. And pre-COVID, we were planning to do a couple of major new studies about kids and teens and mental health and the impact of technology on that. And then, of course, COVID happened and everybody's world was turned upside down. And then what we then did, and you know Mike Robb, our head of research, who we've worked with a number of times together, he led this very significant study about the impact of COVID in particular on the mental health of teens and young adults. So this is 14 to 24-year-olds. And the numbers just leap off the page at you because it's nearly 40% of all teens and young adults feel some sort of depression during the past year. That's just a phenomenal figure. I mean, the second thing what's interesting was we were initially thinking that social media and tech more broadly could have had a very negative impact on young people's mental health. But in fact, what the research showed is that most young people now turn to social media. You heard a couple of the folks on the video for connection, for finding relationships. We've all been stuck on Zoom screens and locked in our houses. And so it's been incredibly important actually for young people, but for all of us to have the connectivity that the web provides, the internet provides, that social media provides. And in many ways, they said we were surprised to see that young people say it makes them feel better now, much more than they used to a year or two ago. So there's a lot of good things to be seen here about some of the social media and technology platforms. I think a couple of the other things that are apparent that the folks on the video referred to was one, young people are now really go online to get help. They actually know how to get counseling online. They go on for other tools online. They do that without asking their parents or somebody like Sarah in the health service. They just go and do it. They know to use online. And obviously, education and medicine and health are never going to be the same after COVID-19 because everybody discovered all these new things. And I think the other thing, though, that you see was there is also this incredible amount of racist and hateful content on the web. So if you're going on social media, and we've done so much work on that issue at Common Sense, and you see that young people are almost twice as often exposed now to racist and hateful content in social media, and that's doubled in 2 years. So it's a really mixed bag, but it's an incredibly interesting point. And the truth is, we're at this critical moment for our country and for young people. I'm so glad the students are here to talk about this today. But this research could not be more compelling.
Jim, thank you. So Dr. Van Orman, let me ask you, you're on the front lines with young people and you're on the front lines. You're also managing teams of people who care for them. We felt the impact of this really up close in the USC community. Does this report reflect the realities of what you're seeing on the ground and also what you're seeing across the country?
Yeah, thank you, Willow. And thank you, Jim, for this really important work. There's so much to unpack in this. I'll just mention a few things. One important thing is that we knew even before the pandemic, we were really seeing unprecedented levels of anxiety, of depression, of mental health crisis among our young adults, particularly college students. So it's really important to understand that so many of our young adults were grappling with this before the pandemic. And what we're really seeing now is this additional trauma, this additional really significant event kind of layering on top of a situation where students were already struggling. We've done some of this data collection here, specifically just at USC. In addition to what Jim mentioned, the numbers look very similar. A third, maybe more of our students having significant depression. We also have asked questions around a sense of belonging. And we see within our own student population, those numbers have significantly declined in the past year. We know that sense of connection, that sense of belonging is so important. That is, I think, is something that we're going to have to think about, particularly as we think post-pandemic. The other thing I'll note, and in my role, one of the things I do, the students might know this, is I tell people all the time to don't get together, stay in your apartment, don't get, that's my job to prevent the spread of COVID. But I always, at our team, we sit back here and we think, what we're telling students to do is so counterintuitive to what they need to be doing. For many of our students, we say only gather with your household. Well, your household might not have your friends in it. It might not have your romantic partner in it. It might not even have people you like. So many of the things we've needed to do from a public health standpoint to keep people disconnected, I think have disproportionately impacted young adults, where the people that they are closest to may not even be in their household. So very important work, and I think just so much to discuss.
One of the things that I find most hopeful about this is the ways in which young people are using digital tools, to manage their own health. And that's particularly true, Jim, from your data in the 18 to 22-year-old cohort. How are you seeing young adults navigate and use digital tools to manage their mental health?
Well, in a really sophisticated way. I actually think that's one of the most encouraging aspects of this is that, one, as we know, a lot of young adults are way more competent on social media than we are. And they actually have figured out how to take advantage of telehealth and telemedicine. That's why I made the point earlier that I do not think health and medicine are going to be the same post-COVID-19. And I don't think education is, because we've all learned different forms of distance learning, telehealth, et cetera. It's interesting because I think about it in the context, I'm a father of 4 kids, and our youngest is a junior in high school. So even listening to what Sarah was just saying, I think it's been really, really hard on our youngest kid, because teenagers just certainly don't want to hang out with their boring parents. That's number one. And number two, they want to relate to their friends. And it's been a really interesting challenge as a parent during this period, even as a privileged parent, right? I'm not living in the poorest part of town, and with some of the challenges that so many, and haven't had a family member die of COVID or become incredibly sick. And having said it, just watching our junior in high school go through the challenges and really need to be with his friends. And then you're trying to balance the health concerns that you have about physical proximity to people and masking and social distancing, with the fact that they just want to be with their friends and they need that. And we've loosened up. I will tell you, as a dad, we've loosened up over the course of the year because we had to. And I would think that's true for teens, but also for you. I'm really interested to hear what the students think about this too, because in my role as a Stanford prof, I've worried about how the students are hanging in there, because so much of your life is social and your relationships. And sorry, a Zoom screen is not the same as being with your friends and hanging out with them and just being a normal person. So I think it's fascinating, but I think we're moving into a whole new era of where young people know how to use tools really wisely on the web. But we also, I would say, have to hold the tech companies, particularly the large social media platforms, accountable for all the bad stuff that goes on those platforms. That's
I want to talk about that in a little bit too, for sure. So, Dr. Van Norman, let me just ask you, and then I want to bring in Josie and Anushka, who I know have questions on this topic. How did technology factor into the USC's response to in particular, the mental health crisis during the pandemic? And did digital media play a role?
Yes, I think there's I agree with Jim that we're never going back when it comes to telemedicine. And that's a real kind of gain. And I'll just share just a very kind of small detail that we're really excited about. So one of the challenges we have with providing mental health services, or challenges of mental health services for students, is, they live in 10 places during the year, 5 places. They're home, they're on their campus, they might be studying abroad. And while right now we still have a lot of constraints at the federal and state level of providing telemedicine and telemental health across state lines, the ability to provide seamless care for students so they don't have to interrupt, particularly their mental health treatment while they're going home, for example, for break, has been tremendous. We saw for the first time ever that our mental health visits surged over the end of the semester between December and January. And that's a time normally where students have a disruption in care, whereas this year we actually saw students continue in care. So I think the availability of telemedicine, of telemental health will only continue as we continue to kind of implement it. And I think will really improve access to mental health services for students.
Can I ask you were you allowing therapy? I mean, were you guys making therapy available to students in this sort of format?
Yep. Yeah. So we transitioned to telehealth for our medical as well as mental health services, in about 2 weeks' time. We also saw that nationally, our college health centers and counseling centers transitioned to telehealth. And we saw, if we look proportionally about the number of students we can serve, we almost see double the utilization than we did pre-pandemic. So the telehealth transition was rapid and it was well utilized. I think we all still struggle with the state licensing issues, but to the degree that we're able to provide those services, it was well utilized, and our satisfaction among students who are using it it's really high. I think many of our students won't want to go back.
Anushka, you have a question on that point, don't you?
I do. Thank you. For students who access these resources, how effective do they prove to be? And have you noticed a significant improvement in their mental well-being, and also the difference of in-person visits versus telemedicine?
Yeah, so I think this is an emerging area of research. If you actually look out at kind of research in general, a lot of this is we're still sort of working this through, but telemental health in particular has a really strong foundation of some fundamental research that says it's effective. And that's what we found with the students as well. We have some objective measures we follow in terms of, scores that people in terms of their distress levels and anxiety and depression, and those improve as much or more with telehealth and mental health services as they do with traditional in-person services. And we've also seen that our satisfaction with our telehealth services is actually higher than we've seen with our in-person services. We think it's important moving forward that people have a choice. We know for many people they want to return to in-person care, and so I think it's really important to plan for that. But for the most part, we're seeing as good, if not better, outcomes for the mental health services as we would for traditional services.
And I just want to let everybody know that Dr. Murthy is on the way. He will be with us shortly. So we're looking forward to having him here with us. I also want to let everybody know that we are going to save time for audience questions. So please go ahead and use the chat to populate that with your questions. So thank you. Jim, I'm wondering how, when you dug into the data, how nuanced you were able to get fairly nuanced in how different cohorts of the people you studied engaged with and used digital media. I'm thinking about, for example, your respondents who skewed higher on the depression scale, who really struggled with depression. Can you give us a sense of what that looked like?
It's actually in some ways emblematic of, I think, what happened in this country. So if nothing else, the COVID-19 epidemic showed the extraordinary inequality in America. It just laid bare the extraordinary inequities in our society, right? But I think this study shows it in a mental health context, which is that the most vulnerable amongst us got hurt the most and had the least resources. And we all suffer anxiety, all the issues that that we've been talking about, but it's really, really tough on low-income communities and communities of color. And so to me, that it just calls for change and addressing these extraordinary inequities. And I think whether it's this study and I'm sure when Dr. Murthy gets here, he'll say the same thing, but it's extraordinary to see this. And honestly, if you're lucky to be a student at SC or at Stanford and have the kind of resources you can get, it's the kids who didn't have that kind of support and those kind of resources who probably suffered the most along with their families.
Yeah. Josie, I'm going to let you go ahead. Oh, go ahead, Sarah, and then we'll let.
Oh, I was just going to follow up on that, Jim. It's such a good point. The thing I would note, though, is even at USC, we actually have some USC student-specific data, and our African-American Latinx students were twice as likely to have experienced a personal loss of someone in their family who had been impacted by COVID or lost someone to COVID. And then also we're seeing extraordinarily high numbers of students who are reporting financial distress related to COVID, who are having trouble kind of with meeting their basic needs. Up to a quarter of students that report that COVID-19 has directly impacted their ability to meet their financial needs. So it's amazing that I think sometimes perceive of student populations as very privileged, but understanding the deep inequities that exist even within our SC student population.
Thank you for that, Dr. Van Orman. Go ahead, Josie.
All right, so kind of what you've been talking about, Mr. Steyer, about healthcare and how we're not going back. The Common Sense report outlined that 85% of participants use the internet for health-related information, and 47% used the internet to connect with a healthcare provider. So do you think that now that healthcare is on the line and telehealth is on the line, that there will be more urgency to close the digital divide that currently exists in America?
Well, I'm glad you asked that question, Josie, because that's what I was about to say. The other issue you have is this yawning digital divide. So we did research, by the way, it was the basis of the stimulus plan that the Biden administration just put forward and that was passed by Congress a couple of weeks ago, which makes it just clear there were 16 million young people. By the way, this affected kids in LA Unified a ton, Willow, right? We work a lot with the folks in LA Unified and in some of the poorest school districts around the United States. And what you see is 16 million kids either didn't have the requisite broadband connectivity or devices to do distance learning. So that means they're not able, Josie, to do telehealth either, because they don't have the broadband connectivity or the devices or both. And there's over 1 million teachers. This was really unbelievable. There were over 1 million teachers who didn't have the necessary broadband and connectivity. So you have an extraordinary digital divide. And by the way, the stimulus bill just had $7.1 billion in it for that. You're going to also see, and the new broadband, the proposal that they just announced, the infrastructure bill has $100 billion in it for broadband. And by the way, that it's not just you guys live in LA, and I know the part of LA where you are. So you have pockets near the USC campus that are not wealthy parts of LA, which are suffering from the same digital divide problems. But you also have this in rural areas around the United States, right? So to me, the digital divide issue is critical, but it's emblematic of the bigger inequity that we're facing. And I hope, and I'm actually pretty optimistic, that we may be on the cusp of pretty dramatic social change here. And where one of the silver linings of COVID, and there have been a lot of challenges that COVID brought all of us, but particularly the lowest income and most vulnerable portions of our society. But I think it may have finally woken people up to the extraordinary inequality in our society. And the proposals that are on the table will cut child poverty in the United States in half. and will actually, if implemented effectively, will actually once and for all close the digital divide, which should have been closed, by the way, years ago if we had been on it as a society. So one silver lining is we saw how bad the digital divide is, Josie, but now I think we're in a position where we can actually close it.
Mm-hmm. I know Abel has a follow-up question on this whole notion of equity or lack of it. Abel?
Yes, my question is along the lines of how do we ensure that all Americans are kind of not left out of this conversation in mental health? I know that there's a lot of essential workers that may be struggling with it, and nurses and stuff like that. So how can we ensure that we're using these digital tools to keep people in the conversation outside of universities and people that are working from home?
I mean, I don't know what you would say, Sarah, and we just got joined by our good friend, Vivek Murthy. Hi, Vivek, great to see you. But because he knows this issue really well, not just as a Surgeon General, but as a father. I think we're going to have a broad public awareness campaign. It's one of the things we're looking at Common Sense on a big scale. In fact, I was talking to Willow about this earlier today. I think you're going to have a broad public awareness campaign throughout the United States aimed at all communities, and you're going to have to target communities individually about the resources that exist. And you're going to have to do it in multilingual efforts. You're going to have to really understand who the folks are that you're trying to reach out to, and explain to people the resources that are available to them. And by the way, and then make it easy for them to access those services and those opportunities. So you need both the funding to do it, and I believe the Biden administration and Congress may actually come through on this, but then you're going to have to educate the public about the fact that it's available, and here's how you use it, and here's why it's healthy for you. And also, it's okay. I'm sure that Dr. Murthy will say that it's okay not to be okay, that a lot of us are not feeling okay right now.
Yeah. Dr. Murthy, great to have you with us. Thank you. We're so glad that you were able to make it. And, you know, one of the things that we are so grateful to you for is it's been abundantly clear throughout your career, but certainly in your confirmation hearings and since your appointment, that mental health was going to be a top priority. And your ability to identify what you called a deeply concerning increase in mental illness during the COVID-19 pandemic, particularly among young people. So thank you for putting this on the national agenda, and thank you for joining us in this conversation. Abel just asked a question of Jim. We were talking about the digital divide and those kinds of inequities. And Abel asked a great question about inequities in the way we discuss and put forward issues of mental health, and how can we ensure that we're not leaving people out of this conversation on mental health. So I wonder if you might give us your thoughts on that.
Absolutely. Well, Dean Bay, thank you so much, first of all, for having me. And it's so nice to see my old friend, Jim Steyer, here, who's been such an incredible leader on this topic. And to everyone who's joining, I just want to say thank you for having me. I'm so sorry that I am egregiously late here. There's literally only one reason why I'd be this late, and I was actually with the president, and I could not step away to come join, but I ultimately did. And so, but again, I also told him I would not leave him if it were not for this event. So I apologize for being late. But with that said, the question you're asking is such a good one, Dean Bay, and what it really speaks to is the question of how we define this larger issue of mental health. Like, who does it apply to? I always get a little bit concerned when we talk about it in the context of mental illness, right? Because number one, not everyone always thinks about themselves as having serious mental illness, even though many of us, if not all of us, struggle at points with our mental health and our emotional well-being. The truth is we exist on a spectrum, and our goal is not so simply to avoid meeting clinical criteria for major depressive disorder, right? Our goal is to really thrive. It's a function of the optimal end of our emotional well-being scale, so that we can not only be fulfilled, but so we can show up for our family and our friends in the ways that we ultimately can when our emotional well-being is high. And the reason I think that definition is so important is because that broadens a circle of people who should be involved and concerned about this conversation. Like, I think about my 3-year-old daughter and my 4.5-year-old son, and even now I can see that they have different personalities, different things like perturb them. They react to stress in different ways. They have sort of they're resilient in their own ways, but quite different from each other. And I want them to grow up in an environment, not just at home, but more broadly in school and in society, where their emotional well-being is recognized as something that's important and supported, where we don't just see it as a nice to have, but we see it as a necessary part of what we need to live a fulfilling and happy and healthy life. And I'll tell you, even as a doctor, I think about my medical school training, I was not really taught that much about mental health and emotional well-being. I was taught, about the biology, of the brain. I was taught about the criteria for diagnosing major depressive disorder. I was taught about psychiatric medications that you can prescribe for people. But all of us, I think, likely know that that is just one small element of the much broader context of mental health and emotional well-being. And so part of what we have to do, I think, and part of the reason I'm so excited to be here with all of you, with young people who are really, I think, in many ways at the forefront of this culture shift that we're trying to make, change how we think about mental health, about the importance of it. We have to recognize it's as important as our physical health and the other half, if you will, of our overall health. But that kind of culture change, that shift in thinking, that doesn't happen because a law is passed. It doesn't happen because somebody writes a book about that subject or because somebody publishes a Surgeon General's report. All those things can help in various ways. But culture ultimately changes because people in their everyday lives decide to think differently, to speak differently, and they stand up to share those views with the world. And that's why I think all of you, I think of you as agents of change when it comes to culture. And that change, that culture change, is the biggest part of what we've got to do. Policy is important, don't get me wrong. Education is important, but culture change will ultimately drive our outcomes when it comes to better mental health.
Dr. Murthy, thank you, because you've beautifully transitioned us to the topics of this conversation that I think our students are most interested in and engaged by, which is sort of how we transition to a post-COVID reality, and more broadly, how we shift the culture. And Josie, I might go ahead and just toss it over to you in your question about sort of transitioning to a new normal.
Sure. So the United States and the world are likely going to experience some type of post-traumatic stress when life returns to a new normal. And what do you think are some of the possible effects of the pandemic? And from a public health perspective, how will you and other officials go about dealing with that?
Jim, you want me to start? Do you want to start?
You go,
Dr. Orman?
Sure, Vivek,
okay.
You go.
Okay. Well, I think it's a really interesting question, because as painful and as difficult as the pandemic has been, as much as it has actually, in some ways, likely led to higher rates of anxiety and depression, which we're seeing now, and isolation and loneliness as well for many people, I actually think there's a silver lining here to this pandemic, which is it has taught us and really reminded us of some very important truths. The most central one being that we need each other. That as much as we have, grown up in a society that is centered around the individual and might tell us that strength is really about independence, it's about not needing anyone, it's about making it all on your own. The truth is that we can't all make it on our own. In fact, almost none of us can. We need each other for our health, for our success, and for our happiness. And for people, and I think who were just, engaged in the busy work of a busy world, going to work, going to school, writing papers, applying for jobs, buffing your resume, doing all the things you're told to do, as you're growing up. I think this pandemic really ground our world to a halt. It separated us from one another. I think for many of us, led us to recognize just how painful that separation was, but also gave us a moment to take a beat, to pause, and to ask ourselves, what do we really want a post-pandemic world to look like? And I'll tell you one thing that's very clear to me is I don't want a post-pandemic world to look like the pre-pandemic world. I want it to look better. I want it to look like a world where we are actually more centered around people and our relationships, where we don't actually feel embarrassed to take a job because it's close to our family, even though it may not be as prestigious in the eyes of the world, or to go to a school that might be closer to our family, even though it may not be as high in the US News and World Report, rankings of universities. This fundamental question to me is, how do we lead a truly people-centered life? That, to me, if we are engaged with that question, if we act on that question, then we will have made something of this pandemic. We will have taken something from it and made our lives better. And to be honest, I'm thinking about that myself right now as well. Like I started my tenure as a Surgeon General, but for the last year, and which is based in Washington, D.C., but for the last year, I've been largely in Miami, Florida with my wife, my two kids. This is where I was raised, and my parents and my sister still live here. And I'll tell you that, despite writing a book, on subjects related to legislation, all this kind of stuff, like it took the pandemic and living together with my family for me to realize on an even deeper and visceral level that, oh my God, our relationships truly enrich our lives in profound, profound ways. So one of the things, like you asked, like, what are we going to do from a policy and administrative perspective? I'll tell you that I've had a number of conversations with President Biden over the last year about mental health, about the importance of social connection and loneliness. And he understands this actually from a very deep personal perspective as well. It's not just a theoretical thing. He knows how critical and essential mental health is, and wants to invest in it. And already, the administration has made a big financial investment in it through a law that they worked to pass, what is also sometimes referred to as a relief bill, also called the American Recovery, policy. And what we did actually through that is put a huge amount of money into mental health, into expanding behavioral health centers, into expanding support for mental health providers. And there's more to be done. But I want us to also realize that as important, again, as policy is, it's the conversations we start that ultimately shift culture, right? And this is a responsibility that people like I have, that Jim has, that others who, in whatever sphere of influence we have a responsibility to drive that conversation forward. But the conversation is only sustained on mental health if people in their everyday lives choose to talk about it around the dinner table, choose to raise it with their friends, choose to share, their own story on social media. And so that's how I will be thinking about my work, is how do we use the lever of policy, but how do we build a larger grassroots movement, if you will, in our country around mental health and emotional well-being, so that we can make it a priority, so we don't feel ashamed about talking about it in the public square, and so that we invest in building schools and workplaces and neighborhoods that ultimately support social connection and emotional well-being.
Thank you. Abel, do you want to follow or?
Yes, I'll follow. My question is along the lines of mental health and COVID moving forward. So how do we help get people back on their feet in terms of resources or understanding the new normal? So when it comes to vaccinations ramping up and socializing safely, like getting back to that, how can we provide people those resources that they need?
Well, it's a great question. And I think that as more and more people get vaccinated, what we're actually seeing is more guidance that's coming out from the CDC, the Centers for Disease Control and Prevention, that's telling people what they can do if they're vaccinated. And that's encouraging. And the more of us who get vaccinated, the more you're going to see those rules open up even further, telling us that we can actually start to see our friends more and more, that we can start to gather in larger and larger groups. So number one, that guidance will come out increasingly, it will be forthcoming. But I think that the second, and I think harder question really is how do we design the right life for ourselves? Like if you're on a college campus, like what should life look like post-pandemic? Again, with the understanding that we have an opportunity to make it even better than it was pre-pandemic. And there, I actually think the solutions will be very local. I think that the people have to have and start these conversations in their communities, whether it's on college campus or whether it's in a workplace or whether it's within your extended family or circle of friends, of how do you actually want to live and operate differently now. We know, for example, this is something I was talking about with a number of you actually just yesterday when we did our listening session. We know that the people, when they have authentic, genuine conversations with each other, that's a very, very powerful ingredient for connection, right? And it doesn't have to be for a long period of time. It's not like you need to be, sort of locked in a dungeon and have deep conversations for 3 days to come out with a deep connection to somebody. Sometimes just 5 minutes of truly being open and vulnerable can actually make you feel deeply connected to another human being. But a lot of us don't necessarily, what we need is a little nudge to get into that space. We need a little bit of structure or a little bit of opportunity to feel like we have the permission to do that it's safe to be vulnerable. How to create those kind of circumstances is a subject of the kind of conversations I think we need to have. on our college campuses and in our families. And lastly, I'll just say this, even if you think about your friend circle, right? Just think about the people you love in your life, people you care about, your family and your friends, and ask yourself, post-pandemic, what would I want to do in my interactions with them to really strengthen and deepen those relationships? A few things that occurred to me, like one thing that I want to do that I've committed to doing is actually picking up the phone when people call. Now that seems like a simple thing to do, but how often do we let our phones just go to voicemail, right? And we figure, and then people don't leave voicemails and they just text us, right? And so then we lose the opportunity to hear their voice also. But as human beings, we were designed to see people, to hear their voice, to enjoy the texture of interaction, not just the content of interaction. And so that's a very small thing, right? Picking up the phone when someone calls, even if I don't have time, I'll just say, hey, I don't have time, but can I call you back? And that interaction, which took 10 seconds, less time than it would take to text them, actually makes me feel a whole lot better. Another small thing that I did is deciding to leave voicemails for people. And I realize that sounds like so 20th century to leave someone a voicemail. But the thing about it, I did that because I had this friend who would leave me 1.5 to 2 minute long voicemails every now and then, because we would miss each other a lot. But I would love just hearing his voice, and just hearing about his life. And it was such a beautiful way to just to stay connected to him, even though we would often miss each other. For all of us, there are going to be small things that we can do, right? And I'll leave you with this notion that when it comes to strengthening human connection in our lives, it's the quality of time, not the quantity, that matters, right? 5 minutes of interaction where we're truly present, where we're open with one another, where we give ourselves a permission to be vulnerable and honest, can often be more powerful than 30 minutes of distracted conversation, when you're catching up with a friend, but also checking Instagram and looking at the scores on ESPN and doing multiple things, as we convince ourselves that we can multitask, which the truth is science tells us we can.
Thank you. So I want to continue this stream of the conversation on changing the culture, because as I mentioned, I know our students were really interested in mining that further. And I also see there are some questions in the chat that's coming in. So Josie, I know you had a question about students, what role students can play.
Yes, and this can go to anyone on call, but how as students can we continue to push for more investment into mental health and be a part of the cultural change that needs to happen?
Yeah. Sharon, why don't you tell us?
Yeah, thank you for that, Josie, and thank you for your really good questions about it. I think part of it is engaging in the dialogue like this. And I think that we know that access to clinical services is incredibly important, right? We want to make sure every student who is experiencing a mental health condition or distress has access to the highest quality services, immediately accessible at a cost they can afford. But I think it's really important to recognize that's really only a part of the solution. Most of it, and earlier when I started this, we talked about this idea that we've seen among our students, this real decline in the sense of belonging. And I think that really resonates with what Dr. Murthy said about the connections that are needed, those are sort of some of the fundamental ways that feed our mental health, that feed our sense of well-being. So I think for students, I think it's really important, first of all, the advocacy that you're doing. So becoming educated, understanding the data, understanding the facts, understanding where the policy levers are, and thinking about that in multiple circles. So what are the policy levers right at USC? What are some of the policy levers that you can think about locally within the city of Los Angeles, within the state of California, and then at the federal level? So kind of engaging on that level as advocates. I also really encourage students to think about within their own social circles, within the groups, the student groups within their school, what are the structures there that they can influence, whether that's their one-on-one interactions, the interactions they're having in the classroom, the interactions they're having through their student organizations. Are there structures where you can create those moments of sharing, where you can create those practices around connecting? So I think I always think of things at a local level, at an individual level, but then how do you connect into bigger structures? So I think there's a lot students can do. I think here at USC, students have been a really important driver, for example, of expansion of mental health services. And now it's really kind of looking at some of the other cultural aspects that we need to as well. So those are just some initial thoughts. I'm sure Jim and Dr. Murthy would have more to add to that as well.
Well, the only thing I would say to you as the non-doctor on the panel is, but the reason I'm a professor at Stanford for 30 years is because I think that you guys have the ability to change the world, students. That's the reason I'm a professor, period, full stop. And I want to remind you guys, Dr. Murthy would not be the Surgeon General if it hadn't been for young people in America, meaning the vote, this was a really huge turnout election, even in the middle of a pandemic. And young people were the deciding, voted in far huger numbers in 2020 than in 2016. That's number one. So number two, I come from a generation where students used to totally believe they could change the world at a societal scale. And I grew up, I was alive during the Vietnam War period where students literally got the United States out of a war, fought, were on the front lines on the war on poverty, had a huge impact politically in our country. And I say to my students at Stanford all the time, it's great what you do locally, and I agree with what Dr. Van Orman just said about what you can do locally, and you can hold the SC folks accountable, and even Dean Bay will listen to you about how to make the Annenberg School better, et cetera. But you can also change the world in Los Angeles and in California and at the national level by being active. Young people have an incredible voice. You also understand the tools we're talking about, not just for mental health and telehealth reasons, but for political organizing. So I never underestimate the power young people have to change our society. And I watched you all nod when I was talking about the gross inequalities we see in our society right now. Those need to be rectified. It's a national tragedy over 40 years. And you know that because you've seen it in your own communities and you can see it within a mile of the SC campus. And I would just say to you, you have the power to change that by being politically involved, by getting involved in your own local community, but and you have the power to change the world. And I know that you will.
One of the most powerful moments for me during this whole long year was this fall when our student government and our president and our leadership of our fraternity and sorority groups sent out a letter to our student body asking them not to gather over Halloween and over the kind of the sports celebrations that were going on. And they wrote this very eloquent letter about how, this COVID was disproportionately impacting our neighbors around USC. And it was so powerful to me, the recognition of our student population, of the great disparities in our community, about how their actions could directly impact the people that live around the community at USC. And for me, for someone who was working on it, I was just so struck and so moved by our students' recognition of that and recognition in their role in addressing some of the great inequities in our country.
Thank you, Sarah, for sharing that. Anushka, I know that you have a question about another way that we might be able to help. So go ahead.
Thank you. I just wanted to know, how can we destigmatize resources and encourage more people to get to them? We greatly appreciate all of the efforts that all of you in your respective fields have done to make mental health resources more accessible. But oftentimes a faceless number on a billboard can feel daunting. So how can we humanize that interaction? This is a question to all.
Vivek, you should answer that. You're so smart at that.
No,
you are.
I don't know, Jim, I'm happy to take a crack at it. Anushka, this is a good point. And I know that some of you and your classmates had raised a concern yesterday, which I thought was really smart, about how people don't really understand what therapy is. And it feels like there are barriers to getting it. And even though we hear the word therapy and mental health a lot, that it's still mystified, for many people. So I think one of the things that we have to do to destigmatize treatment is actually to have people talk about their experiences with treatment more. That normalizes it, it demystifies it, and it helps people see that it's okay to reach out for help. I think the second thing we have to do, though, is we also have to make treatment more easily accessible to people. One of the things that has happened actually during this pandemic has been that we've had a dramatic push to use distance, healthcare, to use telemedicine. And we probably accelerated by 10 years, really, our adoption of telemedicine through this pandemic. But I'll tell you, one of the things that I would hear often from people is that the stigma and the sort of shame around mental health was not just about talking about it, but it was actually about walking in to a therapist's office and having somebody see them walk in, having to sit in the waiting room while people are staring at you, wondering, I wonder what's wrong with that person. And people I recognize there's some portion of people who just didn't feel comfortable doing that, especially in small towns in rural America, where a lot of people may know each other, where close social networks exist. And so telemedicine is really interesting because it allows you to engage with therapy on your own terms, like in your own place. It also helps to reduce some of the structural barriers to getting care. If you don't have transportation to get to someone's office, or don't have the time to take off from your job to go for an appointment. So I think we both have to make access easier, but I think also the more we are able to talk about it and share it, our experiences, the better it is. And the last thing I'll say to normalize mental health is actually to think about ways that we can make treatment or general evaluations a more standard part of how we operate. Like, if, for example, if somebody said that you had to have a physical exam, right, as part of your intake, before you started a job or entered the military or entered, university, most people would think, well, okay, that's fine. I'll get a physical exam, right? To make sure that, but how many of us would think twice if we were told that we needed to get a mental health evaluation, right? But if it was a standard part of what we do, if we had a way of normalizing it so that people could just understand, how they're doing. Are there any problems that they may not be aware of? Concerns that they may, a professional may be able to help elicit? That could be very helpful for some people. So I think this is what we have to do: talk about it more, normalize it more, make it easier for people to access care.
Mm-hmm. And Abel, I know you want to jump in, but there's a question that's coming in the chat, Dr. Murthy, that I thought I would raise for you on this issue, which is insurance reimbursement, right? And insurance coverage. Is there anything we can do at the federal level to really open that up for folks?
So the answer is absolutely yes. There was a big, I think, step forward made in terms of covering people in our country in 2010 when the Affordable Care Act was passed. And as it got implemented, literally millions of people gained health insurance, but it didn't solve all of the problems in the healthcare system. There are still millions of people who are left out. The American Rescue Plan, passed just a month or so ago, actually significantly expanded help for people to get insurance as well, building on the Affordable Care Act. So that is adding another layer, of coverage. But with mental health in particular, there are still barriers. In 2008, which feels like a lifetime ago, there was a law passed, the Mental Health, Parity and Addiction Equity Act, which actually made it illegal for insurance companies to discriminate in how they paid for mental health care versus physical health care. But we still find that in so many places, that law is actually not adequately enforced. And so even when people have insurance, sometimes they aren't able to get mental health care with sufficient access because, again, of challenges around reimbursement. So these are places where federal and state government can be very helpful on continuing to expand coverage, make it more affordable, but also ensure enforcement is taking place with laws like the parity law that are already on the books.
Mm-hmm. Abel, go ahead. I know you had a follow.
Sure, yeah. So along the lines of work and insurance, I know that we see this topic come up a lot in a business setting, from mental wellness days to company-covered treatment using apps such as Headspace and Calm. What benefits do you believe people have of working through their issues on their own time?
Well, I can start us off. I think of this, again, very similar to physical health. If you think about your physical health, there's benefit to going to the gym. There's benefit to thinking about what you eat and choose to buy in the grocery store. And there's also benefit to going to a doctor and getting professional help, when you need it for a particular challenge, either for a general evaluation or for specific problems as they arise. And I think mental health is a similar thing. Some people, and many people, will get benefit from finding tools on their own that they can use. Some of those may be apps. Some of those may be individual practices, whether it's meditation or exercise or other tools that help your emotional well-being. And then others will find benefit from also seeing professionals and getting professional help. And these aren't mutually exclusive either. In fact, just like we do with physical health, it's likely that you need a combination of two. Many people, need a combination of two to ultimately get to a place where you're functioning, again, at the top of your mental health and emotional well-being scale.
Mm-hmm. Thank you.
And you bring up physical health. I know that there was a question in the chat about physical health and kind of what benefits do you see of placing an emphasis on physical health and kind of tying it into mental health as well?
Dr. Orman, Jim, I don't want to monopolize, so I want to.
Oh, yeah, no, Abel, it's such a good question. And I think I'm trained as a primary care physician. And like Dr. Murthy, you know, sometimes when we're training, you know, there wasn't the emphasis placed on mental health that there is now. But in my view, I think there's too much of a dichotomy between the two. And if we really look at best practices in this space is taking a much more holistic look at patients in the healthcare settings and just people in general. So exactly, whether that is, as Dr. Murthy mentioned, how we pay for services, how we have people access services, but more importantly, even as we think about kind of where we screen, where we provide those services. So for example, we know one best practice is to embed mental health providers within our primary care practices, because we know for some people, for example, different cultural backgrounds, many other backgrounds, they're going to be much more comfortable talking to their primary care provider, having their primary care provider ask them, and this is something we are implementing at Student Health, when they sprain their ankle, doing that little check-in, seeing if they're experiencing depression, and then using that as an opportunity to link them to either just supportive resources or, if needed, a full complement of mental health services. So the more I think that we can make it sort of more of a holistic view of patients, provide many doors for people to get in and access mental health services, whether it's through an app, their primary care doctor, or a mental health clinic, I think the better for sort of destigmatizing and making it just a routine part of how we care for ourselves.
I think that's such a great point. You know, and Abel, what I would say to you is, I'm not a doctor, unlike Dr. Murthy and Dr. Van Orman, but I work out and have since I was in college. I work out every day and I meditate. And with my energy level, if I didn't do those two things, I don't know what would be true for me. So I think there's an incredible connection between physical and mental well-being. I think they're totally interrelated. I do not have the clinical expertise that our other panelists do, but I will tell you they're completely related. If I am in a bad mood or had a rough night, the number one thing I can do is get up and work out and also meditate. And I actually think it's incredibly cool now to see meditation being made popularized by things like Calm. I'm serious. And I think I believe that holistic renewal is just so central to everything. And that's why I'm glad that Dr. Van Orman said holistic, because I think you have to look at it as all related. And again, I don't have the clinical expertise as our other distinguished panelists, but it's such a basic part of my daily life. And I want my kids to learn that for me too, not because I preach it at them. I just want them to see that I do that every day, because I think it's so related. And I think that if we learn, I'm so excited that the fact that we've talked about the silver linings of the pandemic, because this has been a really hard year in many different ways. But the truth is, if we can come out of this by learning a lot of lessons and being a better, more equitable and healthy society, then all the challenges we've gone through will have been worth it.
Thank you, Jim. There's a great question in the chat, and then I'm going to shift directions after we do this, which is, and maybe our students may want to be part of the answer here, which is students aren't monolithic. And Sarah, you got at this cultural differences in terms of how people access care. But the question is, there are cultural and regional issues that prevent individuals from seeking out care. So how do we help those in need while understanding pockets of resistance, family concerns, or other factors that impede the help that's available to them? And, Josie, Anushka, and Abel, I would have you weigh in as well, because you may be aware of certain cultural factors or generational factors that impede access to care, and you might have solutions for how we get around those. So I'm going to do this thing you're not supposed to do and just sort of toss that to the group and see who wants to dive in.
Sure, I can go first. Regarding like the cultural issues that go on, I guess I know that in the Latino community, some of these issues are hard to bring up, especially when in terms of conversations surrounding mental health. And I think getting people to express themselves or realize that their stories aren't that much different from others would be something that could really help people. Make sure that we're including everyone in terms of the conversation, as well as like meeting them where they are. So I know that my project, Canta y No Llores, is a podcast that focuses on bringing music from Latino culture and bridging the gap between people either looking for care or experiencing grief, and how they use music to cope. So maybe investing in the arts or something that can give people an outlet when they're experiencing these mental health crises.
Go ahead, Josie. I know you wanted to pop in.
Sure, yeah. So one thing, I've been through my own mental health treatment throughout college, and something I've noticed is other friends who have been there with me that are from different cultural backgrounds do not necessarily have professionals that match their backgrounds and their stories. So I think something to look at moving forward, whether it's in the USC community, in the entire nation, is how do we encourage more diverse people to be on the mental health professional track, and how can we invest in their educations? Because I think that's going to be a big part of our nation's mental health moving forward, for sure.
I think just to chime in, starting with that grassroots approach to mental health, as was mentioned, is leading by example from whatever community you're in. I know that as a student at USC, I'm a part of many different communities, and in some, I have a space to be more vulnerable, whereas in others, I know that perhaps that's not the time or place. But in all those communities, we're all united by the same problems. So it's also up to us as students who feel more comfortable with addressing mental health to bring that to other students and cultivate that environment.
Thank you both. I want to just maybe do one last question, and Dr. Murthy, thanks for staying a little bit longer with us. We spoke a little bit earlier about what we I think all consider to be one of the really optimistic findings in the Common Sense report, which is how much young people are turning to digital tools and apps and social media to navigate their own challenges and to find their own solutions. So would you advocate additional investment in support in that space? And then, Jim, I'm going to ask you to follow by saying, is that something you think that the private sector should also be doing, to really working to make these tools more available, more effective, safer, and healthier? And Dr. Murthy, I'll start with you.
Well, I think of I think social media is a tool. In the end of the day, it can help us, it can harm us. It depends how we're using it and how we're showing up on the platform. If your engagement with social media is primarily one where you are passively sifting through people's posts and feeling like you're comparing your life to their life, that rarely leads to great outcomes for people. As a friend of mine put it, the experience of passively surfing your feed is the experience of comparing your average days to other people's best days, and you often come up short, if not always. So that's not a great experience. But to me, the hallmark of healthy use of a platform like social media is, can you be honest and vulnerable? Can you listen deeply to what other people are saying and develop a deeper understanding of them? If you can do those things, then they could be potentially quite powerful. Social media and sometimes can help you find communities that can be incredibly healing and supportive. But those are really the operative questions. And they're not just the questions to ask at the beginning, but to ask throughout. Because sometimes we start off, having really authentic, wonderful interactions on social media, and then or joining a private group, for example, on a platform and having a wonderful dynamic, but it can evolve over time. And we can find ourselves trying to be somebody that we're not, or trying to fulfill other people's expectations rather than showing up as ourselves. So to me, those are really critical to understand, in our interaction with social media. And that's why I think, and I know Jim has certainly been such a powerful leader in helping us take a more nuanced look at social media. But you can't paint it with a single brush, right? And say it's all good or bad. But this also, I think, creates a responsibility for users, but also for the companies that build these platforms to understand what the impact is of their platform, how it's being used, We know that it's rare that people just put things out there and let them be used in whatever way makes sense. These platforms are designed and engineered in ways for you to guide your use, right? And so for entrepreneurs that are building new platforms and those that are curating and developing existing platforms, my challenge to them is to, number one, understand what the impact is of your platform on the mental health of your users, and then to take responsibility for designing platforms that move people toward the kind of interactions that ultimately lift up your mental health instead of increasing people's feelings of anxiety, depression, and isolation.
And so, first of all, I think it's a great question, Willow, and I'd say two things. First, I run the organization that's probably the biggest critic of the tech industry in the world. And on the one hand, we have been very, very critical of big social media platforms like Facebook, Instagram, YouTube, et cetera, to the people who run those companies for many years over the negative impacts on the social, emotional, and cognitive development of young people, the misinformation, disinformation that's undermined democratic institutions and norms during your guys' lifetimes. So I think on the one hand, they need to be held accountable for that. And I really mean it starts at the leadership. I cannot stress enough how much that starts at the leadership of those companies. On the other hand, and I think we're at a critical tipping point, by the way, because I think this is going to be the first administration that takes this on in a really thoughtful, comprehensive way. And some of my and Vivek's colleagues who are in that administration, I think are going to do some amazing stuff. The other side, though, is absolutely right, Willow. There's so many positive things. And this study makes that clear, that the platforms can do, and that the biggest tech companies, which are the richest, most powerful companies in the history of the world, they are. And a handful of them have unparalleled power, not just over our lives, but over our democratic norms and institutions and other things. And I think they're in a position now where they will be held accountable much more for the positive stuff they can do. So all of the good examples we've seen about platforms being used for positive connectivity, for all of the examples we used, how the tools for mental health and telemedicine and telehealth can be used, that's incredibly positive. I believe those companies, and I've said this to their leaders on many an occasion, could transform education if they would invest in it more, not by themselves, but by using the trillions of dollars of resources that they have to improve the education system and to also deal with the fundamental inequality that they've both contributed to, but have the opportunity to change. So I think we're at this extraordinary moment where they're going to be held accountable for that. And I actually think the voices of users and young people like you students will be critical in this, right? And so I think I do not underestimate your power to change those institutions. You may go work at some of them, by the way, and you ought to hold the people who run those companies accountable for what they do, just like you should hold the administration at SC or at Stanford accountable for what kind of university they run. So I think we're at this incredible inflection point, and I think COVID has brought it out. And I will just say, what a great discussion. It makes me really up. I'm so happy Vivek Murthy is the Surgeon General of the United States. That alone makes me incredibly happy. But what an interesting time and discussion we're living in. We're coming out of this. And it's going to be really important that we take advantage of the next couple of years and move so many of these things in the right direction.
Jim, thank you. And Dr. Murthy, I'm going to leave you with a final thought. But before you do that, would you just give us a sense of how the fight against COVID is doing and what you think we need to do collectively to kind of get us to the winning end of this battle?
Well, sure. It would be unusual to end a conversation during the pandemic without touching on COVID in some way. Look, I think that overall, the fight against COVID is going well, in the sense that here in the United States, we have vaccinated nearly 110 million people. We have seen deaths among nursing home residents, where we were really seeing a tremendous toll of the virus. We've seen deaths really plummet. We've seen more and more people who were hesitant about taking the vaccine, like in December, who are now saying, you know what, I want to get this vaccine. I've had a lot of friends who've gotten vaccinated. They've done fine. I want to be protected too. When can I get the vaccine? Those are all good things. And we are vaccinating more and more and more people every week, which is phenomenal. Last weekend, we hit 4 million people vaccinated in a single 24-hour period. So, at a time where I know that our COVID response hasn't always been the best, from the beginning, and there are places where we've struggled as a country. The vaccination place is actually a real bright spot, both the development of the vaccine, which took place over the last year, and now the sort of the delivery and administration of the vaccine. With that said, there we are, even though the light at the end of the tunnel is getting brighter, we're still in the tunnel. And we are, in fact, right now seeing that cases and hospitalizations are ticking up in the country, especially in particular regions like Michigan, for example, as a state is really seeing a dramatic increase in hospitalizations and cases. So we're certainly not out of the woods, because as many people as we have vaccinated, there's still millions of others who have not gotten vaccinated. And think about it this way. Every person who is not vaccinated is a potential place where the virus can hide. And the more people we get vaccinated, the more we give the virus fewer hiding places, and we get to the point where there's no virus, like in our communities. And so that's why what I would suggest to all of you is, when the vaccine becomes available to you, which will be very, very soon. We anticipate by April 19th that everyone in the country who's an adult should have access, should be eligible to get the vaccine. But when it's available to you, get it. And when and if you need information about it, the CDC has great information, like it helps you understand the science, or around the vaccines and why this was actually developed rigorously, tested rigorously, and why it's safe and effective. But if you get vaccinated, do one more thing, which is help other people get vaccinated. Talk to your family and your friends, talk to the people that you love, and talk to your classmates and ask people, hey, do you have a plan to get vaccinated? Do you have concerns or questions that I could help answer? Think about this as a way that you can help protect others, take care of people you love, and help our country and our community get back on its unstable footing. So overall, the news is good, but we still have a lot of work to do to ultimately get to a place where we can go back to seeing each other, to gathering, in large numbers, and leading our lives the way we want.
And then you did mention that you had some final thoughts that you wanted to share. I wasn't sure if that was it.
Just one final reflection. I mean, just to echo what Jim was saying, it is like, this is the part of my day I've been looking forward to the most. And I don't say that to actually every group that I talk to, but I say that because, especially having spoken to some of you yesterday, I was telling my team, I was up late actually last night, like working, and I was like, I want to go to bed. It was like 2:30 in the morning. I was like really tired. But I was like, let me just send one last email to my team about that listening session that we had with the USC students. And I wrote to them and I said, and some of them are on Jessica and a few others, but I said, yesterday that listening session was a highlight of my day. Of all the many, many things we did, it was a highlight of my day because it inspired me. It gave me faith that the rising generation of leaders in our country are asking the right questions. They have the passion that we need. They're the leaders, that the country and the world need going forward. And what I want to say to you is this: I know it can be easy when you look at the world, especially if you read the news or listen to the news, to think that the world is just fundamentally broken in so many ways. And that's not to say that there aren't things that are problematic. We have extraordinarily disturbing inequities in our society. We have people who are treated poorly just because of the color of their skin. We have people who can't access healthcare, who aren't treated fairly in the eyes of the law. We have so many challenges, right, to create the equitable society that we ultimately all want. But I don't want what's broken about the world to obscure what is beautiful about the world, to obscure the potential that all of you have to fix those pieces that need mending and to ultimately move us closer to a world that we all want. There's a wonderful mentor of mine who lives not too far from Jim, actually in the Bay Area, Rachel Remen, who was telling me a beautiful, very old Jewish story, childhood story, where this is the story goes. The key lesson from this story is that the world is not broken; it is just hidden, and the way we find it is not with our eyes, but with our heart. And the power of that story is to truly be able to navigate the world, to be able to do so in a way that allows us to see it in its entirety. We have to use not just our head, we have to use our heart as well. We have to have the courage to be open and vulnerable. We have to have the wisdom to pause and listen to other people, recognizing that sometimes it's through listening that we learn, that we allow other people to feel heard, that we build connection, and not just by what we say. And I want all of you to know, like as you go through this world also, and over the years that come, that your worth as human beings, despite everything that we may have been taught growing up, that your worth is not connected to how much money you have, how famous you are, or how much power you have in your job. Society tells us that, right? That's how we measure success. But fundamentally, we know our worth as human beings when we're born. As children, if you watch young children play, as I watch my 3 and 4-year-old, they're not worried about what school they're going to get into, how much money they're going to make, if they're going to have a bigger office than the person next to them. They're going to have more Instagram followers than the people in there. Like, they're not thinking about all of that. What they're thinking about is how to feel joy. And sometimes the older I get, the more I realize that there's deep wisdom in children, and that there's something that they have to teach us, something that we forget over time, something that becomes obscured by all the lessons, if you will, and values of society around us. But a fundamental lesson that our power, our fundamental self-worth as human beings is intrinsic. It comes from our ability to give and receive love, our ability to be kind, to be compassionate. And I say this to you because I want you to know, beyond a shadow of the doubt, that you have all the self-worth that you need right now, that you are born with the power to create a kinder, stronger, more inclusive world. And that's what we need. The greatest movements in the world's history were created and driven by people your age, whether it was the founding of this country, the civil rights movement. As I was growing up, I would hear about the movement for independence in India, the country that my parents grew up in and came from, also led and driven by people who were young. Change comes from people like you. So don't ever think that you need to wait 20, 30 years until you're quote unquote established in order to make a difference in the world. You have the power to do that right now. And as you do so, never forget who you are. Never forget where your worth comes from. Never forget that you have the power through the force of your love, compassion, and kindness to make other people feel seen and heard. And in that sense, all of you have the power to heal. Because I'll tell you, as a doctor who's written prescriptions for many medicines over the years, medicines that are strong and powerful and the product of extraordinary science, there are a few things that are more powerful than love in terms of its ability to heal, than compassion in terms of its ability to heal. And just remember, you have the power to wield those sources of healing. So thank you for giving me this incredible opportunity to be with you. Thank you for thinking about these subjects. Thank you for already being the leaders in changing and shifting culture and raising the right questions and pushing us to think of the world not just as it is, but to reimagine it as it should be and to be the force behind making it so. And I hope certainly to read about what you do, to hear about it, to stay in touch with Dean Bay, with Dr. Orman, with all of you, and certainly, of course, with my good friend, Jim. But I just know that we need you in the world. All the things that we've been talking about here, the change that has to come, this isn't just, oh, it would be nice if it happens and hopefully you can help. This is, we need you to be the leaders. Leaders of not just the country, but the world needs to create a stronger, kinder, more compassionate world for all of us. Thanks.
Dr. Murthy, I am most certainly going to let those be the last beautiful, powerful, inspiring words. Thank you for your service to our country and for joining us today. Dr. Van Orman, you for your constant stewardship of the health and safety of this community. Jim, my friend and collaborator, thank you. Abel, Anushka, Josie, always a privilege to spend part of my day with all of you. So thank you all for this very important conversation and for lending your voices to it. And thank you to all who joined us today. Looking forward to seeing you back here in person very soon. Bye-bye.
I see you.